the state has to not be missing in action, which sometimes it is. These are all cash bleeding cows. There is donor fatigue is a real thing.
Hi, my name is Faria Sayed. Welcome to Unboxing Success.
We at SINA, we have one of the lowest per patient costs.
Ambareen Thompson is the CEO of SINA Welfare.
94% of all patients are zakat eligible. We see about 1.5 million patients.
SINA has been providing primary healthcare services for 25 years.
And it is a battle.
I think you're an optimist.
Yes, an optimist who's in therapy, yes.
Her life-changing work impacts lives across the country.
I ran away from home at the age of 13. Left home at about 5:30 in the morning, and I was gone all day. कुछ समझ में नहीं आया, सारे दिन बसों में घूमती रही, public buses में. How many kids today travel in public buses? And I was alone. I was a girl. My parents went looking for me कि किसी train track पे तो नहीं अपने आप को फेंक दिया and all this. I gave them a lot of stress. But at the end of the day, then came back and got on with it. जुतियाँ पड़ी स्कूल ने भी बहुत वो किया. But and I'll tell you one of the things is that there was not that awareness with the schools or with parents back then. Today that has changed, dramatically changed. I mean, the teacher who was one of the teachers. So we had a situation at home. At that time, there were domestic issues between my parents and all this sort of thing, and so obviously you act up. You act up because you're living in an atmosphere like that. Plus, you were a little different. That doesn't help. And teachers weren't very understanding. They weren't trained in these things. So the moment someone was different, someone was anything else, you were labeled a troublemaker. Today, that has changed tremendously. Parents are more aware, etc. But even then, we have got to stop covering them in cotton wool and say कि नहीं ठोकर ना लगे, नहीं ये नहीं हो, नहीं अगर वो like you said if they want to identify as a dolphin, you say अच्छा जी dolphin आप पौधा बनना चाहते हैं आप पौधा बन जाएं. That's not realistic.
Overcorrection हो गई ना बहुत ज़्यादा.
No, we become too politically correct. I completely accept that we shouldn't. I'm very opposed to this name calling and all that. But there is a fine line between humor, between between acceptance and just being overly politically correct. And in England, maybe I always have these battles. Enid Blyton, we all grew up reading Enid Blyton. Today she's regarded as a racist thing, ye thing, gollywog tha. Bhai, it's part of history. If you don't learn from history, how are you going to move forward?
We do need to find a happy medium.
Yes.
But I do think that it's better to be on the side of maybe it's overcorrection, but we do need to be aware. We need to create solutions. Especially when it comes to children or teenagers, they need to know that they have an out, because when I look at the older generation, sometimes they've suppressed their emotions to such a degree that they cannot even communicate their feelings. So I think that sometimes we need to know that what is actually bothering us, so we should be able to communicate that.
Absolutely. देखें जो आपके parents का generation था या जो मेरे parents का, you're one generation behind me. My parents are probably one generation behind your parents. तो उस ज़माने में तो distress, PTSD, depression, all these were stigmatized. First of all, there was no recognition of the problem, and those were heavily stigmatized. फिर अब हमारी generation, frankly, look at the evolution we've made. So within the educated classes, it's almost aspirational to be in therapy.
Yeah.
I'm in therapy. My husband's in therapy. My son, I have sent him for therapy because we have that support available. I'll tell you interestingly, I work in urban slums. We do healthcare. So I work for an organization called SINA, as you know. And जो हमारे sites हैं, we have 40 sites, but in 12 of them we offer mental health. So these are places like Baldia Town, Yusuf Arfani Goat, Gadap, Hingora, really places where 94% of all patients are zakat eligible. So you know what that means. They're well below the poverty line. Yet when we started the mental health program, today we have 18,000 patients who have gone through the program. And you know, they have become, many of them come back to tell us that they become productive members of society again, and that they have been able to go back to work because they're no longer suffering from the depression or whatever. And when they feel ke dobara ho raha hai, they come back. So you know, there is an acceptance also. Absolutely, we need platforms. We need, look at where we live. I mean, there's a constant bombardment of negativity, stresses, economic, emotional, societal, legal situations. Absolutely, we need to create spaces for people. We need to be able to have those conversations.
Okay, so you mentioned SINA, the organization that you're working with right now. उसके बारे में कुछ बताएं. What are the initiatives that you guys are working on? कौन से projects चल रहे हैं आजकल?
So SINA is an organization that's been working in the healthcare sector for the last 25 years. In fact, this is our 25th year, and it's doing what is called primary healthcare. जिसको I guess everywhere else in the world they call it family medicine. The slight problem with Pakistan has been that, you see, if you think about your own health journey, so 70% of your health journey is sorted out by your family physician, जो आपका GP होता था, and then 10-12% of the time you go to a specialist, gastroenterologist, rheumatologist, whatever it is. और उसके बाद ये कि अगर कोई सर्जरी होती है या कोई कॉम्प्लेक्स प्रॉब्लम होती है, then you go for a hospital, which is called tertiary care. पाकिस्तान में ये हुआ कि for whatever reason, एक तो हमारे क्योंकि medicine is an expensive education, takes time, और plus for many years we were only retaining 40% of our doctors. 60 to 70% या तो वो practice में ही नहीं आते थे, ख़वातीन शादी कर लेती थी, they were the doctor बहू syndrome जो होता था, या बाहर चले जाते थे, वापस नहीं आते थे. So we were retaining only 30-40% of the doctors, महंगी education, so they only wanted to specialize. They didn't want to do, you know, family medicine. And the government did not pursue this, did not have a plan. So you have one of the lowest budgets in the world in healthcare. You have one of the lowest spending in the world. और उसमें tragedy है कि 70% of the spending has been in tertiary care hospitals. So you build these big hospitals and you spend 70% of your budget there instead of being the other way around. So only 30% of your budget should go into hospitals because that's what you need, and 70. तो इसीलिए आप जब देखते हैं जिना हॉस्पिटल देखते हैं, सिविल नज़ला है, खांसी नहीं होगा, लोग वहाँ पहुँच रहे हैं. That's not their job. That's not what we should be doing. So Dr. Asif Imam, who is our chairman, he's a practicing doctor. He returned from the US. He decided he was going to go back and serve in Pakistan, and he saw that this was what was wrong with the healthcare. So he set up the first primary healthcare clinic in Baldia town in the slums, because again there was also a huge need. And today we have 40 sites, and we see about 1.5 million patients. And these are, so we manage the health of the entire community. They don't have to go to hospitals, you know, and they can be seen easily within walking distance.
I mean, when I think about it, is that if we just cut it off at that point, maybe so many problems could be solved. I mean, so many diseases are preventable, so many the vaccinations ho jaye, infections are prevent ho jaye. So what is the role in your opinion? So
frankly, like I said, because we are in the communities, we are easily accessible, we are affordable. You know, patients are able to come back after 3 days, 5 days, whatever, and actually give you feedback. We become like these community centers हम बन गए हैं. You know, so the women also come back there, and they'll just talk to the doctor about things. You know, एक तो बीमारी या जो भी आप कहें, एक तो physiological होती है और एक psychological होती है. So they're also able to address the psychological needs sometimes, because all they sometimes need to do is talk to someone. आपने vaccination की बात की. Absolutely, all our clinics are part of what is called the expanded immunization program. Very boring, but just to say, the government of Pakistan is committed to vaccinating all under 2-year-olds, which is very important, because आपकी जितनी भी ये childhood diseases होती हैं, BCG और ये malaria, I'm sorry, not malaria, but chicken pox, measles and all that, you know, millions of children missed out on that vaccination. Polio है. but if you get those done, you know, they lead to healthier adolescents and then healthier teenagers and so on and so forth. So we are part of all that, and they're absolutely the panacea for health, because not only are we seeing day to day things, dengue ho gaya, kisi ko bukhar hai, kisi ko infection hai, whatever, we've also got, we do hepatitis screening, we do TB screening, we provide family planning advice, you know, we do vaccination ki humne baat, we also have now mental health as part of this thing, because you know, more and more we are realizing that mental well-being is an essential part of good health. So you know, we are able to do that. We manage comorbidities. आपके यहाँ आज happily or unhappily, Pakistan is number one in one thing now, diabetes. You know, yeah, in the world, we have just
even more than the US.
yes, oh, way more. So we are number one in diabetes now, and that means greater morbidities. So 40% of all your medical deaths are now because of comorbidities. So hypertension and diabetes are the two biggest killers.
May I ask you why you think that is?
Lifestyle changes, bad habits, lack of exercise. So it's a number, and hereditary, and this is this may sound shocking, but I tell you the problem is far larger, because ये तो अभी वो लोग हैं जो diagnosed हैं, जिनकी अभी latent conditions हैं, वो तो अभी आनी हैं आपके पास numbers, but yet we are able to manage these in the communities. अगर ये community clinics ना हो तो फिर वो patients कहाँ जाएं? देखिए, एक vial insulin की इस वक्त 1300 रुपए की है, तो a lot of people think diabetes की दवाई लूँ या राशन डालूँ. You know, so these are decisions, life decisions, that people like you and I can't even think about. But yeah, but they matter for people.
And you know, considering all of these problems in our country and in our cities, और हम ये देखते हैं, उसके बाद भी I feel कि एक जो स्टिग्मा कह लें, या एक प्रोपेगेंडा है, या एक जो conspiracy theory कह लें, कि लोगों का जो, especially because you've been part of a lot of these non-profit organizations, कि यार ये तो American funded है, ये तो पैसे आते हैं, कि पीछे कोई एजेंडा है, and maybe because people don't see these ground realities, ये क्या हो रहा है और वो actually पैसे कहाँ जा रहे हैं, maybe शायद ये कुछ NGOs के part पे भी शायद कुछ responsibility है कि maybe they are not able to you know, articulate it in a way where these people can understand, because ठीक है, हमें समझ में आता है, जैसे आपने कहा कि एक certain you know, level के लोगों को समझ में आ रहा है कि क्या हो रहा है, but these people once they're helped maybe they understand, but otherwise ये एक misconception है, या एक ये projection इस तरह की है कि यार ये तो पैसे आ रहे हैं, ये तो कोई funding हो रही है, ये तो पैसे खा जाते हैं, you know, lifestyle के लिए आ रहे हैं, क्या हो रहा है, तो प्लीज़ थोड़ा सा इसको explain कर दें कि ये क्या है NGOs का.
So देखिए, बात ये है कि अच्छे बुरे हर जगह होते हैं, and there is no doubt कि there is, frankly NGOs की बात नहीं करते, बात करें आप UN organizations की, ठीक है, UNDP की बात करें, UNICEF की, these are all, with all due respect, these are all cash bleeding cows. For every $100 that is donated, they spend $50 to $60 on themselves. Although there has been a lot of checks and balances, our friend Mr. Trump has shouted about it long and hard, not hard but long, you know, rather loudly, and he's not wrong in saying that. But पाकिस्तान में ऐसा नहीं है, well है, probably कहीं है, but for example SINA की मैं आपसे बात करूँ, SINA is entirely funded by zakat. So 90% or 95% of all our funding comes from zakat from Muslims in Pakistan, and Pakistani diaspora से आता है हमारे पास. जो हम, we are a Sharia compliant organization. अच्छा, उसके अलावा ये कि गवर्नमेंट ने बहुत सी checks and balances लगा दी हैं. तो एक ऑर्गेनाइजेशन है द पाकिस्तान काउंसिल ऑफ फिलैंथ्रोपी, PCP, यू हैव टू बी सर्टिफाइड बाय देम. FBR आपको वो करता है. देयर आर लॉट्स ऑफ चेक्स एंड बैलेंसेस. लेकिन जो बाहर से पैसा आ रहा है, जो एजेंडा का पैसा आ रहा है, वो हम सबको पता है कहाँ आ रहा है, और उसको कोई कुछ नहीं रोक रहा. यू नो, इट इज़ बीइंग यूज्ड टू फ्यूल एक्सट्रीमिज्म, इट इज़ बीइंग यूज्ड टू फ्यूल certain agendas, but by and large there are good organizations working. I'll give you an example. कल रात को LRBT का एक fundraiser था, and the figure they gave was fantastic. You know, they've been doing this for 45 years now or so. And yesterday they had shown a video of their 54th million patient. 54th million patient. Can you imagine? 5.4 crore people are able to see or have the gift of sight because of LRBT. How amazing is that? In this organization, I can tell you that if it was not for the zakat and the donations of our 120, 130 donors, a lot of them are individuals, some of them are organizations like Engro ho gaya, Gatron ho gaya, textile mills hain जो अपने CSR के उसमें देती हैं. You'd have another 1.5 million patients who would be a burden on the government. And there are other organizations that are doing this. आप Patient Aid Foundation ले लीजिए. I'm not kidding you guys, please take the time to go and see the JPMC unit that is being, it is mind-boggling. I'm registered on the NHS, I'm a British citizen, whatever. I was tweeting from that visit, telling people in England, NHS eat your heart out. This is our JPMC. This is, we have the only cyber knife unit in the world, okay, in the world that does surgery free of cost, don't charge a penny. And it is, पहला जो वाला जो हमारा cyber knife था, वो शायद 3 surgeries एक दिन में करता था. अब जो है वो 30 या 35 करता है. And there's another one on the way. Who is it being funded by? Not by USAID or by foreign aid. It's funded by HBL. It's funded by the Surti Foundation. वहाँ लिख के मैंने लिखे हुए देखे नाम. It's funded by people like that, and it's a government private partnership. So people give money. Pakistanis give money, and because they're seeing it happen, वो है, the government then also gives the money. Government realizes कि हम जो पैसा अपने लोगों को देने तो वो कोई तो खा रहा है, but this way the money is being used. You have the surgical unit that is being built. Each floor is sponsored by a private family. The Chinoys have done one, the Adamjis have done one, Habib Bank has done one, the Surtis have done one, and each one is state of the art. And this is a government hospital, government hospital. So, there are a lot of things in this country we should be very proud of. But what I was saying to you earlier is that, but in all this, what is always needed is the will of the state. The state has to be there. हम private कितना भी कर लें, the state has to not be missing in action, which sometimes it is.
And state के जब हम देखते हैं, हम देखते हैं हमारा वही कि दुनिया की जब हम बात करते हैं तो we had the biggest ambulance system in the world, but वो it was based on charity. It was based like उसमें government का कोई involvement नहीं था. And इस तरह की बहुत सारी organizations हैं जो शायद government वो बना ही नहीं सके या उसको support नहीं कर सके. But I think now अब हमें नज़र आता है because of organizations like yours and other जो कि वाकई उसको system एक framework ऐसा create कर देते हैं जहाँ मेरे ख्याल में it's easier for the cause maybe the government doesn't not have that priority या they do not know how to do it. ये भी एक प्रॉब्लम है कि क्योंकि वही आपकी वाली बात कि वो शायद ट्रस्ट भी नहीं कर रहे कि यार हम अपने बंदों को दे देंगे, इनको आता है नहीं आता. प्लस पीपल हु आर अपॉइंटेड मे बी वो उस सेक्टर के नहीं होते कई दफ़ा फॉर वट एवर रीजन्स, तो वो शायद उस तरफ जाता नहीं. बट मे बी दीज ऑर्गेनाइजेशंस जो कि जिनके पास ये फ्रेमवर्क है, पीपल हु कैन शो नंबर्स, हु कैन शो ट्रांसपेरेंसी, दिखा सकते हैं कि हम वाकई ये कर रहे हैं. तो आई थिंक गवर्नमेंट के लिए भी थोड़ी सी सपोर्ट की बड़ी ज़रूरत है हमारी, स्पेशली इन द इन्वायरमेंट द गवर्नमेंट की हमारी है जिस तरह की. तो इट्स वेरी इंपॉर्टेंट कि हमारी इस तरह की चीज़ों को, और फिर गवर्नमेंट शायद फ्लॉन्ट भी नहीं कर पाती इन चीज़ों को, तो हमें भी नज़र नहीं आता, हम भी हमेशा ब्लेम ही करते रहते हैं. बट लाइक यू सेड कि देयर आर लॉट ऑफ थिंग्स दैट दे आर डूइंग इन कोलैबोरेशन विद अ लॉट ऑफ ऑर्गेनाइजेशंस.
But unfortunately it's not just about flaunting. The people who are doing it very quietly. They do. I feel like we have a lot of cynicism as a country, but there's so much good work happening. Like when you will go and you will see this, once people know कि क्या हो रहा है, कोई चीज़ सही हो रही है, and they are just looking for an opportunity to donate.
अच्छा recently we were also thinking of donating money. बहुत सारे I'm sure लोग जो सुन रहे हैं वो भी सोच रहे होंगे. And like for example I own a business, so मुझे होता है कि यार हम किसी ऐसी जगह इन्वेस्ट करें जहाँ मे बी कुछ लोगों को बिजनेस में हेल्प हो जाए. तो in terms of skill set, what are those organizations जहाँ we can donate?
So देखिए, like I said, there are a lot of organizations doing very good work, and skill building is an essential need in Pakistan. Where the first thing, the first and the biggest tragedy Pakistan has is कि हमारा education system is poor is an understatement. Okay, what we are teaching our masses is outdated, it's antiquated. आप STEM पे ही नहीं आए, STEAM पे तो क्या आप आइएगा? Do you know that in schools, and this is even for private schools, year 3 के बाद आप music नहीं सिखाते. आप music नहीं सिखाते, you don't understand sometimes, or you don't relate with the fact that music and maths development, when you develop musical skills in people, their math skill gets better. This is scientifically proved now, right? तो वो है जो masses आपके पढ़ते हैं, वो उनको जो एजुकेशन आप देते हैं वो इतनी पुअर है कि वो बेचारे किसी तरह पेट पाल के अगर बीए तक कर लेते हैं, उनको जॉब अभी भी नहीं मिलती, क्योंकि वो उनकी स्किल बिल्डिंग इतनी पुअर है कि वो एक एप्लीकेशन नहीं लिख सकते, एक सीवी नहीं लिख सकते. ठीक है जी. Having said that, there are a number of organizations that work in this. For example, with our own self, we realize that a lot of the doctors that come through the system are it's a mixed bag. So what we did is we developed a protocol based system ke quality up, you can manage a consistent quality. We are developing a curriculum which includes things like mental health and all that to retrain or improve the doctor's training. इसी तरह बहुत सी organizations काम कर रही हैं. There's a great organization you guys should check out called Hunar Foundation. Hunar is doing skill training. There's a very nice lady who's just taken over, and she's looking at expanding their offer base. So आपके यहाँ हर clinic में receptionist हैं, कोई there's a whole cadre that can be created, and then because skill building must relate to job opportunities. So they are doing a lot of courses in training people as paramedics, as nurses तो एक diploma होता है, but you need a lot of paramedical staff because आपके यहाँ doctors की shortage है. And there is a lot of things that in the West, midwives deliver babies. Doctors don't deliver babies unless there are complications or a surgical intervention. So there's that. Then you have young people who are learning. Okay, IT is probably the future. You should be teaching your kids coding. You should be teaching our young people can do that. जो problem है, my husband says this, I don't attribute this to me, but he says कि पाकिस्तान में मसला क्या है? For every solution there's a problem.
We find one.
Yeah, we find one. So for unless देखिए how has Bangladesh की एक मिसाल ले लेते हैं. Let's just take Bangladesh or Sri Lanka की मिसाल ले लें. Sri Lanka में what I found was even the rickshaw driver that was driving me, he was immaculately clean. ना उसके मुंह में पान था, ना उसके पास से स्मेल आ रही थी, बहुत साफ सुथरे कपड़े पहना हुआ था. और क्योंकि मैं सिनहलीज नहीं बोलती, वो उर्दू नहीं बोलता, हम we communicated in English and we chatted, and he was a college graduate. उसको कोई उसमें शर्म नहीं थी कि वो ग्रेजुएशन करके वो रिक्शा चला रहा था. He was fine with it, because बांग्लादेश आप पिछले 5 साल पहले तक की बात ले लीजिए, 1 Pakistani rupee was worth about 2 takas or 3 takas. आज it's the other way around. What did they do to change it? Let's not talk about the political thing. They made it a bit more secular or whatever, but they concentrated on 2 things: education and women's empowerment. Those are the only 2 things they did. And today they are outpacing Pakistan economically, on all social indexes. They have gone past us. So absolutely, education, skill building, definitely. And like I said कि हुनर है, बहुत सी organizations कर रही हैं. Indus है, for example, they've started a program, family medicine में है. बहुत सी ऑर्गेनाइजेशंस कर रही हैं.
अच्छा, एक आर्गुमेंट मेरा इसके साथ भी बहुत होता है, वो ये होता है कि फॉर एग्जाम्पल व्हेन वी टॉक अबाउट चाइल्ड लेबर, ऑब्वियसली एक पूरी दुनिया में है कि भाई चाइल्ड लेबर ऑब्वियसली गलत है, बच्चों को स्कूल जाना चाहिए, पढ़ाई करनी चाहिए और फिर काम करना चाहिए. बट मैं हमारा इससे होता तो वी वर टॉकिंग अबाउट फीफा की हम बात कर रहे थे, फीफा की फुटबॉल्स की हम बात कर रहे थे, एंड देन यू नो वहाँ पे बच्चे किस तरह ये काम कर रहे हैं सारा कुछ. तो जो स्किल की हमने बात की, मुझे लगता है कि कहीं ना कहीं डिपेंडिंग ऑन कि आपकी यू नो इन्वायरमेंट आपको क्या अलाउ करती है, आपका सोशल बैकग्राउंड क्या है, उसके लिहाज से मैंने कहा कि शायद उस जगह पे जहाँ एक बच्चे के पास अपॉर्चुनिटी है और उसको आप ज़बरदस्ती काम करा रहे हैं, कुड बी चाइल्ड लेबर. बट डू यू आई मीन आई वांट योर थॉट ऑन इट कि ये जो अगर हमारे बच्चे फॉर एग्जाम्पल वो इतना परफेक्ट फुटबॉल बना रहा है इस वक्त कि पूरी दुनिया में पाकिस्तान के फुटबॉल फीफा में जाके वो खेल रहे हैं. आई मीन यू कुड डिसएग्री विद इट, बट आई एम जस्ट सेइंग कि उसका एक स्किल सेट है, उसके साथ उसको पढ़ाया भी जाए, दैट शुड बी, आई थिंक दैट शुड बी इट. बट आई मीन
Rahil, but let me correct you on that one.
प्लीज.
पाकिस्तानी फुटबॉल बच्चा नहीं बना रहा और पिछले 15-20 साल से नहीं बना रहा. I was in the export segment for more than 20-25 years. I was in textiles and export. Back then, yes, there was the induction of children in the labor workforce. But what happened was there was a real backlash from our buyers, the Western countries, and we had to not only certify, but they run audits, they do checks. So in your textile factories that are exporting, or your football industry, or your surgical industry, you cannot and you do not, आपके यहाँ नहीं होता. तो सबसे पहले तो ये sorry, I'm correcting it because it's Pakistan's reputation at stake. We do not have. We used to about 15-20 years ago.
But do you agree? Because obviously उनकी तो है standard कि आपका नहीं होना चाहिए.
मगर एक तो ये कि है नहीं हमारे यहाँ है चाइल्ड लेबर, बट चाइल्ड लेबर कहाँ है? आपकी मिस्त्रियों की दुकानों में है, आपके घरों में चाइल्ड लेबर आ रहा है. और एंड एब्सोल्युटली आप बात बिल्कुल वो सही कह रहे हैं कि देखें, एक बच्चा फाखे मरे या वो काम करे. अच्छा, जब वो काम पे जाता है तो वो उसको 3 वक्त की रोटी भी मिलती है, वो कुछ घर पर बना के भी कमा के भी ले जाता है, घर वाले भी होते हैं. इट इज़ अ सोशल डिलेमा. देयर आर नो ईजी आंसर्स टू दिस. आई कांट से कि ये कर दें तो ये हो जाएगा. वी एज अ कंट्री डोंट हैव अ सोशल नेट नहीं है ना हमारे पास कि काम नहीं करेंगे तो कोई सपोर्ट है फ्रॉम द स्टेट, वो नहीं एग्जिस्ट करता आपके पास. So it is a very difficult question, and there are no simple answers. पाकिस्तान में हमने प्राइमरी एजुकेशन कंपल्सरी तो की हुई है, बट यार about 70 million children are out of schools in Pakistan. We still have one of the lowest literacy rates in the world.
और जो स्कूल में भी हैं वो क्या पढ़?
Do you ever feel overwhelmed when you see the state of the country, when you see the, you know, कि कितने मसाइल हैं मुल्क में? How do you feel when you see कि what can I even do?
I go to therapy. That's exactly why I go to therapy. Okay. That's exactly why I go to therapy. Because
और क्या बताते हैं वो आपको? What is the answer that they give you?
And they help. Well, there are no answers because you know the easy decision for me, the easy aspect for me would be to do what everyone else is doing. Get on the plane and say, not my problem anymore. You know, I can go and live in England. I have a passport. I have homes. I have this. You know, it'll be simpler. But then it wouldn't be fun. It wouldn't be, you know, is that what I want? Maybe when I'm a little older, when I'm tired of this battle. You see, and it is a battle. It is a battle. आप जो बात कह रही हैं, it's a battle if you care. If you don't care, if you live in that bubble जहाँ आप समझते हैं कि you know it doesn't matter to me, but it does, because every time you take your car out, you know, you're fighting all the way from here to when you get home 20 minutes later, you know, या 40 मिनट जो है आप खड़े में. And what are your battles? आपकी battle ये है कि there's lawlessness. अगले के पास एक बड़ी सी गाड़ी है और उसके पास गवर्नमेंट की प्लेट लगी हुई है, जज की प्लेट लगी हुई है, या एक पुलिस वाले की प्लेट लगी, whatever, या एक अमीर आदमी की प्लेट लगी. Exactly. उस वो रुका हुआ है, अब आप पूरा वो है, या एक आप you know, like the frustrations and are too many. There's no two ways about that. But besides going to therapy, I try and look at the good things in Pakistan, and there are many.
Yeah.
Like I said, you are one of the most philanthropic countries in the world. You have, as a woman, I think I have a great network of other like-minded women. I see change in mindsets in a certain segment of society. That's the good part. I sadly also see this change of mindsets in the larger segment of society, which really worries me. We talk about the fact that हम बहुत इतरा के कहते हैं कि हमारे पास बहुत young population, हमारे पास बहुत young population, and that young population is also a time bomb, because you're not educating them, you're not giving them good health care, you're not giving them employment, so what do they do? What do they do then? Then they turn to drugs, they turn to suicide, as we were talking about.
Violence.
They turn to violence. At the end of the day, who do you think is coming? You, I, everyone I know has been mugged. We are held up at gunpoint. Who do you think does that? Who do you think does that? And largely, जब आप victim से बात करें तो कहते हैं young सा आदमी था, ये था, यूं पहना हुआ था, clean shaven था, 20-25 साल की उसकी उम्र थी. यही कहते हैं ना अब ज़्यादातर victims.
Even sometimes younger. Yeah.
हाँ, because you have given them no other options.
So again, I'll say failure of us, failure of the country, failure of the state, because we have no network.
Yes, because we don't have a social net, na? And the biggest reason for this failure is you have a huge population and unchecked, uncontrolled population explosion. ये आपका सबसे बड़ा मसला है. आप उसको address करना शुरू करते, you had one of the most advanced programs. It's like everything else, हम कहते हैं हमारी PIA ने Singapore Airlines बनाई, Emirates बनाई, वो बनाई, यार but अपना क्या हाल कर लिया. It's the same thing, family planning started in Pakistan in 1949.
Okay.
In 1956 we had the first formal, जो हमारा 5-year plan बनता था, we already entered that in this. Today, our numbers are still as bad. आपके आसपास के मुल्क जो है कहाँ से कहाँ निकल गया उसमें.
When you said we are number 1, तो आपने diabetes बोला, I was thinking आप बोलेंगे making children.
We are very high up there.
I'm sure.
Producing children is not the only problem. It's also the kind of children we are producing, because we don't stop we don't educate our people, we don't stop things from happening. आपके यहाँ जो तमाम बच्चे पैदा होते हैं, 27% of them are born stunted, of which there is 11% severe stunting है आपके यहाँ. Severe stunting है. Stunting का मतलब ये नहीं कि कद छोटा है उनका. It means their brains are smaller, so they will always have learning difficulties, they will have coping mechanism issues. They will never be productive members. They will be, but not. They will never achieve their full potential, because they were born with this. You have one of the highest number of thalassemia major and thalassemia minor children being born. That is a lifelong drain on resources of any family, because this is a disease that is passed on. Why does this happen? First cousin marriages. कह के दुनिया थक गई आपको. आप होने देते हैं, करते चले जाते हैं. One of the highest maternal and infant mortality आपकी अभी भी है दुनिया में. But
ये तो हमारे सोशो कल्चरल रीजंस भी हैं, बिकॉज ये लाइक अच्छा इसको वहाँ जाने की ज़रूरत नहीं है, ये तो मतलब why should she go to a hospital? Does a hospital even exist? So many people haven't even seen a doctor in their life if they live in a rural area.
Yeah, you're right. I mean, I would have to see what the number is now, but maybe it's marginally better. But I remember 3 or 4 years ago, we were still saying that more than 53% of women, when they deliver a child, do not have access to a qualified medical practitioner. 53% in the 21st century, don't have access to a medical practitioner.
I remember I went to a hospital in Thar a few years ago, and there were almost 20 women, expecting women, and there was only a nurse there. There was no qualified doctor, and not at that time, but there was no one there overall. So that means only a single nurse was there to attend to all of those women. which is what if what if there's an emergency of some
Yeah,
kind?
absolutely. Or more than one child being born. But again, that's I don't know whether that's because only women have to give birth. So ye kar lenge. I don't know what the reason is. But somewhere along the way we've lost the plot.
Yeah.
It's as simple as that. I understand the disillusionment a lot of young people do face, and the odds are now overwhelming, because it's almost like you need to press the restart button and start all over again,
But I feel like for instance, अभी recently भी एक government change आया, and just in an instant everybody's mindset was like कि hopeful हो गए हम सब. हमने कहा यार चलो अब कुछ हो जाएगा. Although situation हुई थी, सारा कुछ हुई था, उतने ही हम problem में थे. So I think people like you, people who are trying to make a change, I think when we meet you, when we see what you're doing, I think वो hope तो देता है, but like you said कि इतना ज़्यादा है कि उसको करने में time लगेगा, but then again it's not impossible. I mean it can be done, it's just that कि maybe time ज़्यादा लगेगा.
So when I was reading the figures, and again, please correct me if I'm wrong, but almost your staff is entirely female. The people you serve are almost entirely female. So how is it the question that I'm trying to ask is what is it particularly that changes? What are you particularly trying to serve?
It is a conscious effort. We wanted to not just talk about women empowerment, we wanted to actually bring it about. SINA, as you can see, is run by a female CEO. 70% of our workforce is women, and then correspondingly 75% of our the people we see are also women. So we have tried to make sure that we empower women from the community. So जो हमारे जितने भी clinics होते हैं, हम उन्हीं community से we take young women, we train them into paramedics or into clinical supervisors बनाते हैं, उनको हम EMR पे train करते हैं, and we bring them into the into economic empowerment, and we bring them into employability streams. बहुत सी डॉक्टर्स, आपको पता है, वही मैं जो बात कह रही थी, डॉक्टर बहूज टाइप्स जो थी, जिनकी जवानी में उन्होंने शादियां हो गई, उनकी डॉक्टर बनी, अच्छा रिश्ता आया, शादियां हो गई, अब वो बच्चे भी बड़े हो गए. सो व्हाट डू दे डू? We've brought them back into practice, given them what is called continued medical education, got them back on the, and for them it's like the school model. बहुत सी ख़वातीन इसलिए जॉब कर लेती हैं कि they can fit the school job. So we modeled our वो कि हम 9 to 2:30 वो करते हैं. So they're able to practice medicine, and then they're able to give time to their family. So there's a lot of things like that we do. Women are 50% of your population yet.
You are undoubtedly a change maker throughout your life. You have been a change maker. I think your work at SINA is a testament to itself. But it's not the only change you've been making. What do you think has been a change that you've been truly proud of?
So I returned to Pakistan. So just to give you a little bit of a background, I was in the corporate sector for 25-30 years. Then I went to England for 3-4 years, and I did a degree from King's College. My degree, strangely enough, is I have a degree in global terrorism in South Asia, and that's from the War Studies Department at King's, which is the largest defense school outside a military academy. So it was a great experience that I did. But what it taught me was, we equate security with, for some reason, like mostly people with weapons and things like that. But what it taught me was security was about the quality and the equality of resources, and the distribution of resources among people. And that includes education, that includes food security, that includes employability, that includes capacity building, capability. So when I returned to Pakistan, I thought I wanted to bring a change, and one of the things I did, my first return was I came back and I thought one of the most important sectors is family planning, because as I said, one of the biggest problems Pakistan has is we have a population that we have no control over. We call it population control or family planning, but we actually have no family planning or population control. We do have a lot of fudged numbers. ठीक है, थोड़ा बहुत काम हुआ है. We have managed to do work, but nothing like countries like Indonesia. I'm talking about other Muslim countries. Indonesia ले लें, Malaysia ले लें आप, Iran ले लें. You know, they've done an amazing job. But that was my first foray. And then and I'm very proud of the work I did there. I was in charge of a project which set up 1,100 midwifery clinics across the country. And the brief we had was it was deep rural and peri-urban and deep rural. तो ऐसी जगहों पे हमने midwives को train किया, because part of it was to counsel people to have smaller families by doing what you call birth spacing. क्या, you know, 2 साल का 3 साल का वक्फा दें, so that the mother can recover and the first child वो 2-3 साल वही जो vaccination और वो हो जाए, छोटी families हों जितना आप manage कर सकें. But subsequent to that, I joined another organization called I Am Karachi, and that was such a fantastic experience. Because that was something very close to my heart about bringing, it was a renaissance movement about reclaiming Karachi. There was a political vacuum in Karachi at the time, and very sadly, Karachi, which, you know, everyone calls a mini Pakistan and has always been a melting point, we have always welcomed people historically into this city. और ये वो city है जो आपको जिसमें आपको हर नस्ल की, हर फ़िरक़े की, हर मज़हब की आपको इंक्लूजन कराची में मिलेगी. ये कहीं और आपको पाकिस्तान में नहीं मिलेगी. But because of the vacuum, we began to be divided on ethnic and socio-economic and religious lines. So I Am Karachi came about, and the vision was to change that, to reclaim public space, to reclaim public spaces and the narrative. And this was about working with youth and bringing about change through art, culture, music, dialogue. We were operating in a time where, because of security issues, कोई concerts नहीं होते थे, कोई वापस हम open spaces में लोग डरते थे आते हुए. People wouldn't sit next to कि जी मैं महाजिर हूँ, वो सिंधी है, वो पंजाबी है, वो फलां है, वो फलां है. Which was never this was not the fabric of Karachi. So we thought about it long and hard, and one of the things which became very signature and a very visual part of I Am Karachi was we started with changing what we called the canvases, you know, the narratives of hate to the canvases of hope. तो आपकी कराची की जो दीवारें होती थी, वो सबसे पहले उस पर ये होता था कि बहुत स्लोगन्स लिखे होते थे. आमिल बाबा के काले जादू की बात होती थी, एंड यू नो किसी की ज़बान, किसी की लसानियत, किसी की उस पर क्रिटिक होती थी. सो वी स्टार्टेड विद द गुरिल्ला मूवमेंट, जहाँ हम रात को छापा मारते थे, हम 4, 6, 8, 10 दीवारें वाइट वॉश करते थे. उसके बाद हम स्टेंसिल से वो करते थे. इतनी देर में पुलिस अलर्ट हो जाती थी. अच्छा, पुलिस स्लोगन लिखने वालों को या वो इश्तिहार लिखने वालों को नहीं हरास करती थी, वो हमें हरास करती थी. एंड सो वी गॉट बेटर एंड बेटर फ्रॉम एस्केपिंग फ्रॉम दैट. But what that did was it began to bring a change, and the police would read what was written, and they also thought कि यार वैसे ये बात गलत नहीं कह रही, ये अच्छी बात लिखी हुई है. So they stopped. No.
So I'd love to ask you about how you selected the artists, because उनकी जो visual language थी of the walls, it was so deeply Pakistani, and it had you know, it had such an interesting tone to it. You didn't, I mean, it would be so easy to create foreign art and उसको बिल्कुल एक gentrified look देना. What did you decide कि यहाँ पे कौन सा art होगा, उसकी कौन सी मतलब theme होगी?
So there was Adila Suleiman was kind of leading the project, and she and her team first of all made it very you know they made sure that it you know, it was stuff that had a local local cultural, because remember we were called I Am Karachi. It was going to be about Karachi and in all its nuances. So there would have been no point in having Chicago ki wall ya you know, Hawaiian themes or whatever. But how we selected artists was, I think, very interesting, was because remember कि ये होता नहीं था. So finding that skill set was also difficult. उसी ज़माने में what was happening was our cinemas were being updated and they उससे पहले ये होता था कि जो billboards होते थे वो हाथ से बना करते थे, but because of automation these billboards जो थे वो ख़त्म हो रहे थे and print आ गया था, so these artists were losing their bread and butter. So the artists that did the walls were the old cinema artists that we brought to and gave them walls instead of big so that was it. So it was about also again giving them employment. They continuing that tradition of painting by hand.
Okay, another thing that you are considered an expert on is bringing funding and accumulating इस पैसे जिसकी वजह से चेंज आएगा, बिकॉज फाइनेंशियल वाइबिलिटी ऑफ फॉर अ चेंज इज़ वेरी वेरी इंपॉर्टेंट कि आप सोच तो सकते हैं बट इफ़ यू डोंट हैव द मनी, इफ यू डोंट हैव द रिसोर्सेज, इट्स नॉट दैट ईजी. तो हाउ हैव यू बीन एबल, बिकॉज यू बीन पार्ट ऑफ मल्टीपल ऑर्गेनाइजेशन एंड यू बीन एबल टू डू दैट एवरी टाइम. सो व्हाट इज़ द की, क्या वो ऐसे तरीके हैं ऑर्गेनाइजेशन हु आर लिसनिंग जो छोटी हैं जो ये करना चाहती हैं, व्हाट आर दोज की थिंग्स दैट दे कैन डू? इज़ इट अ गुड प्रेजेंटेशन, इज़ इट नोइंग पीपल, इज़ इट lobbying? What is that you think के आपका advantage रहा with being successfully bringing in those funds, those जो पैसे आए और जिसकी वजह से चेंज में आसानी हुई, वो क्या दो फैक्टर्स होंगे?
राहिल देखें, मेरा 20-25 साल का कॉर्पोरेट एक्सपीरियंस था, बट one of the things that I feel कि all organizations have to think about is about sustainability, self-sustainability. You might be in a situation where and COVID and the recent economic crisis has sent that point home repeatedly कि things can change, आपकी funding streams can dry up, and I think very sadly after the second floods in Pakistan जो हमें डोनर फटीक पाकिस्तान ने फेस की कि बिल्कुल आपके मांगने के बावजूद बहुत कम इंटरनेशनली फंड्स आपके पास आए, that was in a lesson itself. So whenever I worked with an organization which collects funds, of course the good work you do and when you are able to amplify it and show results, that always helps because we are an incredibly philanthropic nation. However, there is donor fatigue is a real thing. And as generations, a lot of our donors are older people, and there will be a time when they will step down and they will hand over the reins to a son or a son-in-law or a daughter who may not have the same vision as they do. So whenever I'm in an organization, I always look at how to spread the ask. So you can't just be dependent on 30 donors. If you have 30 donors, then your target should be to go to 50, 60, 70 because then you're spreading the risk. Plus organizations, जिस चीज़ से मेरा थोड़ा सा इख्तिलाफ है, इसकी you have got to stop the culture of free. हमारे गवर्नमेंट हॉस्पिटल फ्री भी भिखारी ना बनाएं. People have to understand कि they have to, देखिए मेरे क्लिनिक में लोग आते हैं, हम 50 रुपए का टोकन लेते हैं, बहुत दफ़ा लोग ये, और हम 100 रुपए की दवाई देते हैं. वी आर वन ऑफ द ओनली ऑर्गेनाइजेशन जो दवाई देती हैं. जो हम दवाई देते हैं वो टॉप 10 फार्मास्यूटिकल्स की होती हैं. एवरेज दवाई जो हम लोगों को देते हैं वो 450 रुपये की होती है. अगर कोई कॉम्प्लेक्स कंडीशन हो, एस्थमा है, हम उसको वो भी देते हैं, इन्हेलर भी देते हैं, या इंसुलिन हमें देनी पड़ती है, वो हमें पड़ती है 1000-1500 रुपये की, बट हम सिर्फ 100 रुपये चार्ज करते हैं अक्रॉस द बोर्ड. अगर सिर्फ हमने आपको प्रूफेन दी, आप पर्ची ले लें, बाहर से ले लें. बट द थिंग इज़ कि उससे होता है ये कि दे बजट फॉर दैट. आई समटाइम्स गेट पीपल who call me or when I go to the clinics and they say कि बाजी देखिए हम यूँ हैं, गरीब हैं, ये है, वो है, whatever and all that. So I tell them कि अच्छा ऐसा करो कि अपना फ़ोन निकालो और मेरा नंबर लिख लो उसमें और फिर तुम मुझे बताना. अच्छा, इनएविटेबली जब वो फ़ोन निकालते हैं तो वो एक स्मार्टफोन होता है, इनएविटेबली. और बहुत दफ़ा शर्म की बात ये मेरे लिए कि वो मेरे फ़ोन से ज़्यादा महंगा फ़ोन होता है. So I feel कि it's also part of education and awareness कि आपको थोड़ा सा लोगों को भी अवेयर करना होता है कि देयर आर नो फ्रीबीज. और जब आप फ्री में देते हैं ना कोई चीज़, उसकी वर्थ भी नहीं होती लोगों की. एंड देयर आर स्टडीज़ अपॉन स्टडीज़ ऑफ दैट. सो देयर इज़ अ लिटिल बिट ऑफ अ कॉन्ट्रीब्यूशन. जो हम 100 रुपये दवाई के देते हैं ना, वो दवाई यहाँ सीने से लगा के रखते हैं और एक गोली खाते हैं और वो फिर आके बताते भी हैं. जब हम फ्री में देते थे दवाई बहुत दफ़ा बाहर फेंक जाते थे, पता कि फ्री किया तो ये तो ऐसी ही होगी, you know, really, or they would sell it. Now they use it. Now they use it because they know कि 100 रुपए की हमने दवाई ली है, हमें दुकान वाला शायद 80 रुपए देगा, मगर ये दवाई एक्चुअली 400 रुपए की हम खरीद नहीं सकेंगे, अपना इलाज नहीं करा सकेंगे कि ये बेच दी हमने. So that's one thing. We've added a lot of things. We had a lab in house. हमने उसको it used to do 250,000 tests, जो हम free test run करते हैं अपने patients के लिए. I had that, उसकी मैंने capacity building की, capability अपने staff की build की. It now got it registered with the SINA Health Commission, ISO certify करवाई उसको, and it can now do 1 million tests. So 700,000 tests are available, again affordable. We compare with Dow का जो service है, which is a lot cheaper than a lot of these other जो आपको मिलते हैं, and उससे जितनी income generate होती है वो SINA को जाती है. We do other things like एक testing service हम कर रहे हैं, जो आपके doctors बाहर के लिए तैयारी कर रहे होते हैं, they need someone to run mock tests, we do that. You know, so there are a number of streams we've created. We're creating a state-of-the-art EMR system for primary healthcare, which doesn't really exist, because जितने भी systems बनते हैं वो बनते हैं tertiary care hospitals के. We intend to market that. We want to run it in ourselves. Already हमारा system बहुत अच्छा है, but this is the next generation of it. So you know, organizations need to take a long-term view. You can't just be sitting there with a begging bowl and think that will keep filling up. It doesn't work.
The saturation point आ जाएगा, and then you need to, जैसे हम बहुत सारी और startups देखते हैं, बहुत सारी organizations देखते हैं कि वो funding पे based होती हैं, not just के NGOs ही हैं, और वो एक point पे saturation point आता है, and then everybody goes their own way, and then वो इतनी सारी effort, इतना सारा time, इतनी सारी
बंद हो जाती हैं.
In a general sense, I think development sector, पूरा जो development sector है, people don't understand how is it funded, how does it run, इसका system क्या है, इसकी transparency, इसकी reporting किस तरह से function करती है, and I think there's nobody better than you to speak to it. How does the development sector work?
Yeah, देखिए development sector, as I said to you earlier, कि कुछ जगहें बहुत अच्छी हैं. I named a few organizations, you know, that are doing phenomenal work. But I also agree that there are a lot of funds that get wasted. I think I am very proud when I tell people that unlike many development sector organizations, we are the only one जिसके पास मेरे ख्याल से 1000 cc की भी शायद गाड़ी नहीं है. हमारे पास जो गाड़ियाँ हैं हमारे, you know, कल्टस है, छोटी या बोलान्स हैं, which is what we use. A lot of my colleagues who are in the same position as I am, but they work for foreign NGOs or they are foreign funded, they come in. मुझे तो complex हो जाता है क्योंकि वो तो SUVs में आते हैं और बड़ी सारी उसमें थी. We don't have that culture. So those are all part of the वो funding जो है, and it's also about accountability and transparency. It depends on what, you know, हमारी जो admin या वो है वो 5%, 6%, 7% पे है. बहुत से organizations की up to 30% होती है, you know, so there are वो, but as I said, there are good and bad everywhere, you know. I have had the benefit कि मेरा background corporate का था, and then I went into public or social development sector, so I'm able to bring that expertise and, you know, you know, I developed what I've always called the, you know, a ROI, return on impact, not return on investment, but return on impact. Because you have to be able to show, okay, for every dollar you spent or every rupee you spent, this is what you got. We, at SINA, we have one of the lowest per patient costs anywhere in the world. हमारा जो, हम हमेशा बार जो $3 के अंदर रखते हैं. And you know, including takeaway medicines, and that works for us.
So basically what you're saying is there's always a right way of doing things, और अगर आप सही तरीके से और honestly कोई भी काम कर रहे हो तो you can make a change.
As I said, you know, organizations like the Patient AIDS Foundation, देखिए कितना ज़बरदस्त काम कर रहे हैं. मैंने आपको LRBT की मिसाल दी, सिना की तो खैर चले मैं कह ही रही हूँ. I'm Karachi में, we were able to change so many lives, you know, and change the narrative, you know, bring people back together. So those are all things that matter, and they are what you call soft impact, but they are vital. It is vital that this work carries on.
honestly, when I look around, I don't feel cynical. I feel truly optimistic. And I think you're an optimist as well.
Yes, an optimist who's in therapy. Yes.
You wanna
But
ask?
yes.
Do you feel like you're changing people's lives?
I do, and that's what keeps me going. There are a number of stories that I could tell you. It would be too long. But as I said, both in all these organizations that I've worked, there are moments of despair. Even when things around you go terribly wrong, there are moments of despair. But then come these stories, and you see that you have made a change. And when you sometimes impact, मैं आपको एक छोटी सी मिसाल दूँ. This is the story. This is not my story, but this is the story of a friend's daughter. बहुत privileged family. Didn't have to do it, but this is what the impact they made. 16-year-old grammar school student, brilliant student, valedictorian, a sportswoman, and all this sort of thing. At the age of 16, has a headache, is taken to a hospital nearby. Told कि नहीं ये गर्मी से स्पोर्ट्स डे की तैयारी में गर्मी से आपको वो हो गया. By the time she gets home, she's not able to get down from the car. They realize something's wrong, rush her to the hospital back. She was having a stroke at the age of 16. And because of the delay, आपको पता है there's a 90-minute window and all this, the hospital messed up. Anyway, she had treatment, बाद में वो सारा हुआ. But you know what? She used her. So they were very privileged people. After उसकी जो rehabilitation थी, उसमें एक वो गई अमेरिका भी गई physical rehabilitation के लिए and all this. And she saw something which was this special bike for people who need physiotherapy or need to get back to, and especially stroke, neurological. And they came back and they asked the Khan and they asked everyone. They said, no, we don't have anything like this. And they didn't have it anywhere in the subcontinent, which means any of the countries around us. So she, with the help, she told, people knew her story and they raised the money. Alina was only 17 by that time, and her mother Sabah, and they raised they raised awareness about it. And people just, all their social circle and other people came together and उन्होंने वो bike import की. They said we'll fund the bike. They spoke to a big hospital which is on the other side of town, and the hospital said कि नहीं अभी तो हमें तो we'll have to go through a lot of red tape और हमें ये करना पड़ेगा. Indus Hospital said you bring the bike and get the training, we will build a wing. Can you imagine? We had nothing like this for anyone who suffers neurological damage. For anyone, आपके पाकिस्तान में इतने होते हैं लोग जिनकी spine injuries होती हैं, neurological damages होते हैं strokes के बाद, and there was nothing like it. So Indus built a separate division. वो bike आई, वो बनी, and I met this one man who told me a story, and we recorded it for IIM Karachi. This was another thing we used to do, the IIM Karachi Awards, where we recognized young heroes, unsung heroes. And this man was telling me he was a painter, had fallen down from the ladder, was bedridden, wanted to kill himself, tried suicide 2-3 times, but then had been made aware of this, was there, and in 7 weeks of treatment, he had gone from being absolutely helpless to being wheelchair bound, and was now able to go do things like go to the toilet himself and all that. And another 7-8 weeks, he would be able to stand, walk, and in a couple of months, maybe go back to work. That's how you change lives. That's how you bring impact. And then when we broadcast that story, the hospital that earlier had said कि नहीं हम नहीं कर सकते, they set up a wing. They saw the impact. Sometimes it takes one person and one life and one story to be told for it to have a ripple effect. The same thing with the walls of IIM Karachi. Started with 100 walls today, and as a direct result of that, within 2 years, there were 37,000 walls across Pakistan. 37,000 walls. We started with 100, then got funding and we did only 3,000 walls. There were 37,000 walls that came up as a result of that. Positivity, art, celebrating heroes, celebrating our culture, celebrating our musicians, celebrating our people. So, Yes, it absolutely. I love the work I do because I think it does make impact.
You use the word, you called yourself an optimist, a cautious optimist, but I think that you clearly are an optimist.
Okay, I would add to that. I don't think she's only optimistic. I think she's, I mean, we can obviously, from what we know about her, she's a philanthropist. She is somebody who's, involved in social work and healthcare and everything. But to me, after knowing you, after reading about you, and knowing you today, I think you're above everything. I think you're a patriot. I feel, somebody who could have gone, could have just left, packed her bags, but you decide to stay in Pakistan. You decide to make a change, and you're not somebody who's just hoping to make a change. You are making that change. And firstly, I would like to thank you for coming in. बहुत अच्छा लगा, बहुत मज़ा आया. And कभी कभार कुछ ऐसे topics होते हैं हमें लगता है कि यार शायद boring हो सकते हैं. But after we talked about you and then we read about it and everything, I was like, yeah, this could be really interesting. And I think हमें उससे ज़्यादा मज़ा आया. And it was completely something that I think जो लोग सुन रहे हैं उनके लिए बहुत informative भी होगा. And people who had ideas about what these non-profits जो कर रही हैं काम वो कैसे करें क्या करें, तो आई थिंक बहुत सारी इन्फॉर्मेशन हमने आज पास की है. एंड टू टॉप इट ऑल ऑफ, like I said, as a patriot, I feel there is something that we also were talking about in the break. फैज़ अहमद फैज़ के बारे में बात कर रहे थे, and आजकल के हालात, and then a ray of hope like you are. वो फैज़ अहमद फैज़ was something similar to that, and there's a poetry जो मैं स्कूल में पढ़ी थी. So I would like to end with that. So thank you so much.
Thank you for having me.
So the poetry is by Faiz Ahmed Faiz. It's called निसार में तेरी गलियों पे ए वतन कि जहाँ चली है रस्म कि कोई न सर उठा के चले.
Wonderful.
जो कोई चाहने वाला तवाफ को निकले नज़र चुरा के चले जिस्म जान बचा के चले. है अहले दिल के लिए अब ये नज़्म बस्त कुशाद जो संग खिश मुक़य्यद हैं और संग आज़ाद. बहुत हैं जुल्म के दस्ते बहानजू के लिए. ये जो चंद अहले जुनू तेरे नाम लेवा हैं बने हैं अहले हवस. मुद्दई भी मुनसिफ भी किसे वकील करें किससे मुनसिफी चाहें. मगर गुजारने वालों के दिन गुजरते हैं तेरे फ़िराक में यूं सुबह शाम करते हैं. बुझा जो रोज़ने ज़िंदा तो दिल ये समझा था कि तेरी मांग सितारों से भर गई होगी. चमक उठे हैं सलासल तो हमने जाना है कि अब सहर तेरे रुख पर बिखर गई होगी. फ़कत तसव्वुर शामो सहर में जीते हैं गिरफ्त साये दीवार दर में जीते हैं. यूं ही हमेशा उलझती रही जुल्म में खल्क न उनकी रस्म नहीं है न अपनी रीत नहीं. यूं ही हमेशा खिलाए हैं हमने आग में फूल न उनकी हार नहीं है न अपनी जीत नहीं. इसी सबब फलक का गिला नहीं करते तेरे फ़िराक में हम दिल बुरा नहीं करते. गर आज तुझसे जुदा हैं तो कल बहम होंगे ये रात भर की जुदाई तो कोई बात नहीं. गर आज औज पे है ताराए रकीब तो क्या ये 4 दिन की खुदाई तो कोई बात नहीं. जो तुझसे अहद वफा उस्तवार रखते हैं इलाज गर्दिश लैलो नहार रखते हैं. Thank you once again.
Thank you so much. And that was a beautiful piece of kalam.
Thank you.
Wonderful, wonderful piece of.
Dedicated
and
to
thank you.
Thank
And
you.
thank you so much for having me.
Thank you
It
so
was a
much.
wonderful session.
Thank you.
Ladies and gentlemen, this was Unboxing Success, the Black Box. See you next time.